It's very easy, I think, to tie in back pain when it appears in that sort of postnatal period to assume that it's completely physical, because our bodies have gone through a huge amount of change, hormonal change, and physical change as well. You know, the pressure on the pelvis, the pressure on the lower back during pregnancy. I had SPD as well during pregnancy. So my immediate thought was, yeah, I've just had my abdominals cut through because of cesarean section. My core is weak. And I was diagnosed with degenerative disc disease, which was all just like, you know, really doom and gloom, because I still got to take care of this little child.
Yeah. You know, again, in terms of I'm still talking about physical. The other major issue is when you're pregnant, it's very difficult to sleep, right? Especially later on in the pregnancy. And now you've got this young baby that's just been born that is not sleeping through the night. So that's another major physical factor that, again, is putting stress on the body. Now, whenever your body's under stress, your perception to pain goes down, right? So you're more likely to feel pain at a lower level, right?
Yeah.
So there are so many factors involved with pregnancy and lower back pain, although this is not necessarily what we were going to talk about today, but it's an important thing to consider, that, you know, again, from my experience of what I've seen, there's very little in the way of education once someone's had a baby. It's like, oh, you've had your baby, off you go, good luck. Right? Oh yeah, we've just done a major operation on you, cutting through all 4 layers of your abdominal wall. We've stitched you up, off you go.
Yeah.
There's no kind of education on, okay, so when can I start treating the scar tissue? How do I treat the scar tissue? What kind of person could I go to help me with the scar tissue? How do I start to reactivate the abdominal muscles? All those things, it's just left for the person to work it out for themselves.
Absolutely. And I think I'm so grateful for the lady that was treating me. She was a sports massage and cranial sacral therapist herself, who was really experienced with scar tissue, really experienced with pregnancy as well. Like, I'd never at the time even heard of massaging scar tissue, but she taught me really early on to kind of to get in touch with that scar, you know. And it goes with any scars, doesn't it?
Yeah.
You have this sort of mental block about touching a scar, and especially if it's got emotional attachments, whether it's a car accident or whatever trauma happened to that scar. Having that emotional connection to touch your own scar, but then also massage it, break down the adhesions and things, was really valuable. And yeah, I didn't even expect you to bring that up, but that's definitely a factor. And pain, as you know, is so multifaceted. And I think we can be so focused on the physical causes of pain. Like, you know, so I had this degenerative disc disease diagnosis. I've had my core, you know, cut into. I'm probably put on a few extra pounds because of pregnancy. So I'm carrying extra weight. I'm also carrying a baby, either on my left hip or my right hip. I'm not doing as much physical activity as I used to because my time is just swept up being a mum. But what I've now know, like 10 years down, is actually all of that is important, but understanding the kind of psychosocial aspects of pain is so important as well. You know, I was dealing with a newborn, lack of sleep, like you say, probably wasn't feeding myself very well, because it was all just a mad rush. And I've got a husband in Afghanistan where I'm like sort of worried about him, obviously, but also a little bit of jealousy in the fact that I was military, but I'm at home looking after the child, and he's doing his job, you know, and I've had to sort of sacrifice a little bit of my job to be at home, which, you know, don't mind at all. But I've now learned through listening to sort of motherkind and other mothers that actually that's really normal to kind of resent that and have a bit of anger. But I sort of felt at the time I'm not allowed to feel that because he's at war, he's serving the country, and I just need to be worried about him. These other feelings are kind of not socially acceptable.
Mm.
But I've since learned that actually all of that played a part in my pain.